Hey everybody, welcome back to theclinicaltrialsguru.com. Again, that website address is theclinicaltrialsguru.com. I'm shooting this on my GoPro camera just because I haven't had that much time lately to do these videos, but I've had a lot of driving time. So I'll be doing a lot of videos for my car every now and then. Don't worry, I'll still be doing the long podcasts, and those will be in the traditional studio/office setting. But this one today, this is recruitment week. I'm actually really happy. This week, I'm coming out with my Kindle book called Clinical Trial Recruitment: How to Recruit Clinical Trial Study Participants. And it's going to be exclusively on Amazon. Initially, it will be Kindle only. It'll be $2.99, much like my other books. How to be a study coordinator, how to manage a research site, and clinical trials demystified. So this one will be $2.99. It'll be in that same price range, and it's going to be all about recruitment. So this week I'm going to do most of my content around recruitment, and in one of the chapters, the book will be divided into two main themes: online and offline. And there's many ways to recruit study participants in both online world and in the offline world. And today I'm going to just talk about one of them. So if you have any kind of a budget, right? Usually when you do your contracts and budgets, they give you a recruitment stipend. They'll give you some type of budget so you can pay money to advertise for the clinical trial, okay? When you're advertising specifically for one clinical trial, let's say you have one study that you're advertising for, that does require IRB approval, especially if you're getting into study specifics. Now, if you're just advertising your clinic in general, you don't need IRB approval. If you're just advertising your brand, if you're telling the world or your market what kind of studies you're doing and what your company is about, you don't need IRB approval, unless you're under the jurisdiction of a local IRB. So be careful. When in doubt, always check with your IRB, local or central IRB. But anyways, when you're recruiting for particular studies, the sponsors will give you a budget. So you don't even have to pay these costs out of pocket initially. You'll eventually get reimbursed back the costs. However, if you're advertising or promoting your clinic in general, no one's going to give you a budget for that. You're going to have to do that yourself. So anyways, back to the particular studies. I've had very good success with Google AdWords and with Facebook ads. Facebook ads are even cheaper. For some reason, the cost per click is cheaper. I see that the leads that we're getting, meaning the people who are clicking on the ad, are not often as good quality leads as the one from Google. But if you have any kind of budget, I would strongly recommend, you use either Google ads or Facebook ads, or try both. You can target specific geographic regions in your market, so you can put people within a 10-mile radius of your clinic or a 20-mile radius of your clinic who are searching for certain terms. For example, we have a Parkinson's study, so I ran a Google ad for one of my sites for Parkinson's and a Facebook ad concurrently to see which one performs better. And it's still too early to tell which one performs better. I have a little bit of a suspicion that it's Google, but that will remain to be seen. But in either case, Facebook, you can get the clicks for much cheaper. So basically what happens is, when you only get billed by Facebook or by Google when someone clicks on your link and actually gets to your site. And in the book, I'm going to talk about what kind of landing pages you want to create on your website for specific ads. So you can have, when you create a website, you can have as many pages as you want. I recommend having one page for each study, and then having people land on those pages. Each ad, like the Parkinson's ad, they should land on the Parkinson's landing page. If you have a depression study ad, those people who click through should land on your depression study landing page, rather than just sending them to your home page where it may not be so clear what you want them to do. You want to have a call to action. On mine, I have an email form where they can sign up if they're interested in learning more about the study. They fill out the little quick email form, push submit, so we'll have their contact information. We can have as little as their name and email, or as much as their name, address, email, phone number, and a little bit about whatever they chose to write. In either case, have a landing page from these ads. Use Google Ads, use Facebook ads, get IRB approval, and see what happens. You might be very surprised to see what can happen from running these ads, as I have. I want to give a shout out to all my clinical trial guru producers this week on Recruitment Week. That's Sarah Elizabeth Siegler, Resolve Research Solutions, Accurate Clinical Trials, Erdhart Clinical Trials, PTNR, Patrick Stone. We have Darshan Kulkarni, Biopharm Systems, Zymewire, Mozio, South Coast Clinical Trials, Breakthrough Clinical Trials, Investigators Research Services, Phlebotomy Services. Thank you guys very much for being producers, and thank you very much for supporting me on Recruitment Week for my book launch, hopefully coming out Friday. All right, so stay tuned for more information on that. This is Dan from theclinicaltrialsguru.com. Take care.